Hi, this is Kirk, the bariatric carnivore. Let's talk about some of the problems that happen when you have increased elevated blood glucose over time, otherwise known as type 2 diabetes, prediabetes, insulin resistance. And these are all problems that can be solved through eating a low-carb diet. That's why I bought into it. This is what saved my eyesight. See, when I was 50 years old, I went to my eye doctor. She told me that I was going blind because the arteries and the veins in the back of my eyes were completely gunked up. And her solution to me was lose weight. That's what led me down the journey to have bariatric surgery. But if she told me what the real problem was metabolic syndrome. The problem was not so much the weight, but the blood glucose. And then I was the type 2 diabetic for all practical purposes. So let's talk about some of the things that can happen when you're a type 2 diabetic or even pre-diabetic. See, the cutoff point, there's a blood test called an A1C. And when you take it, if your level is 5.7 or above, you're a type 2 diabetic. And they tell you that, you've got to take insulin and all this. You can eat whatever you want, just, it's only going to get worse and you'll never be able to get rid of it. And frankly, that's not true. I mean, there's been more than enough studies to show that you can reverse type 2 diabetes without medications, just by changing diet and lifestyle. Basically, eat low carb and exercise, and you'll take care of your type 2 diabetes. But, they don't tell you that, which is why I think, frankly, we have this psychopathic medical system. So, besides potentially going blind and having all this bad stuff happen to your back of your eyes when you're type 2 diabetic, what else can happen? And hopefully this might be motivation for some of you guys to take this seriously. And the way you can find out if you've got a serious problem is with a couple of blood tests. And they're fairly inexpensive. It costs, I just looked it up before I did this video. For $12.95, you can get your A1C tested. You don't need your doctor's permission. You don't need a permission slip from the government. You just basically go online, look up lab test, $12.95 A1C, and boom, you order it, go over to their lab, they'll draw it, they'll email you the results. That's one test. And if it's above 5.4, you got a problem. You're basically pre-diabetic. You're inflaming your artery walls. The other one that you might want to get while you're at it is a fasting insulin test. Now that one does cost $25, but if it's between 2 and 5, you're good. But if it's over 5, you're again bordering on the point of insulin resistance. And let me try to explain to you how this mechanism works. See, your blood can only take about 2 teaspoons or so of glucose in it at any given time, very little. But we eat so many carbs that, for instance, a piece of bread is equal to about 5 teaspoons of sugar, glucose, in your bloodstream. So if you're eating a typical standard American diet, you're getting way too many carbs, way too much glucose into your system. And your way your body handles too much glucose is it starts to produce extra insulin. And insulin is a fantastic hormone. It does a lot of great stuff, but when you have to utilize your pancreas all the time to produce excess insulin, the body starts to store, it wants to store excess glucose, first of all, in your muscles. So you've got that extra boost of energy when you need it. But when the stores in your muscles get full, then it starts to store in your liver, and you start getting fatty liver, and then it stores fat around your vital organs, and then it starts to form adipose tissue all over your body, particularly if you're a guy around your gut, women on their hips. And insulin is a fat storage hormone. It works real well. I mean, that's why, a type 1 diabetic is someone who can't produce. They have zero insulin, and as a result, they waste away. Their body cannot store fat. And the opposite problem is when you're producing too much insulin, your body is storing fat like crazy, which is why pre-type 2 diabetics gain weight. That's why we're all fat. And the way that happens is we have too much glucose in our system, and it's producing all this insulin, and it's trying like crazy to deal with it. First thing it does is it starts cramming it into the fat cells. But what does this extra glucose in the bloodstream do to you? You know, when you're staying chronically elevated in your blood glucose, and this is what the A1C test will tell you, is it's a marker of what has been your average blood sugar for the last 3 months. What somebody discovered was blood sugar has a tendency to stick to red blood cells, and they can measure the amount of glycation on the blood cell. And since a blood cell lasts about 3 months, they know that that's what your average blood sugar is. And it's not a bad measure. The only problem with it is it doesn't measure every bit of sugar. It doesn't measure fructose, but it does measure glucose in the system. And if that's chronically elevated, what you're going to find is you're hardening your arteries because you're inflaming your system. And that hardening of the arteries over time creates some real horrible cascade of events, because your arteries, when they've been inflamed, start to get hardened. And hardened arteries tend to crack. And when they crack, the body creates plaques that cover them and try to heal that area. And when it's done healing, it becomes calcified. But if, unfortunately, some cases, those plaques, while they're still liquid, burst. And if a plaque bursts into your artery walls, it instantly hardens, and it goes rushing through your bloodstream. And if it gets lodged into a small spot in your heart, it causes what's called a heart attack. And the number one symptom that you may have a problem is you die. The leading cause of death on this planet are heart attacks, coronary artery disease, caused by these plaques rupturing. Maybe you get lucky. Maybe it bypasses your heart and it only goes to your brain. And if it lodges in the right part of your brain, you have what's called a stroke. The number one creator of long-term disability on this planet are strokes. If it doesn't kill you, it can permanently disable you. So the joy of having all those extra donuts, processed food, and all those carbs, and following a standard American diet is you may get to be wearing a diaper and having other people clean your butt. That's the joys of long-term disability. So these are, and these are just the beginning problems when it comes to having elevated blood glucose levels over time. And what's really wonderful about this type of disease, as far as big medicine is concerned, is it doesn't kill you automatically. It's a chronic disease, which means it sticks with you for a long time. The patient doesn't die. They just get sicker and require more and more medical care and more medicine. Everybody wins but you. This is why I keep calling it a sick psychopathic system. They could cure it very quickly by telling you, hey, reduce the amount of carbs, change the lifestyle a little bit, enjoy a big steak, and you won't have this problem. But they don't. What else could all this stuff cause? Well, it can destroy your kidneys. See, the kidneys filter out your blood, and when they're inflamed and your blood is inflamed because you got too much glucose, it starts to destroy the small little veins and arteries in your kidneys, which are kind of delicate. And when they get damaged over time, you get to experience the real wonderful, horrible things that happen when you're on kidney dialysis. Something I really wouldn't want to wish on anybody. You get hooked to a machine for hours as your blood gets filtered. I mean, kidney dialysis has saved a lot of people's lives. I'm not going to knock it. It was a wonderful invention, but it is hardly a pleasant way to live. I mean, you get to sit around in a cold blanket in a room, freezing to death as your blood gets poured through a machine and filtered for you. That's the joys of eating all those extra donuts increasing your blood glucose level over time. Maybe one of the first warning signs, if you're a guy, that you've got too much blood glucose, that you're metabolically unhealthy, and that you're having problems is ED, erectile dysfunction. Because guess what? In order for all that system to work, you need to have all those tiny veins and arteries down there to be able to get full blood. They have to be healthy, spongy, etc., and they got to be able to swell up. And if they don't, you don't get to have fun on Friday night. That's part of the joys of having constantly elevated blood glucose levels over time. And again, it won't kill you overnight, probably, but it's going to slowly but surely suck the life out of you. Now, the question is, do you have to put up with it? And that's what this channel's all about. This is why there's so many people that are going keto and carnivore, low carb. Keep warning you about this stuff, because we've seen it. I mean, I came very close to being blind or getting shots in the back of my eyes. I mean, I could have suffered from ED, kidney failure, heart attack, etc. I mean, one of the other advantages of going low carb is eventually your weight starts to stabilize and you get to be at the healthy weight that you're supposed to be at. I mean, you're going to lose weight, you're going to look better, you're going to feel better, but you get to prevent all the other things that happen. Things that your doctor just, and the big food, big pharma, just aren't going to tell you about because it's not their job. You got to figure this stuff out for yourself. Look, in the battle for your health, you're all alone in this. You're the only one who can look after you. You're the only one who can look after your health. Thankfully, we're all alone in this together. That's why I created this channel. So please hit the like and subscribe button. Hit the notification bell. I'll let you know when I put out a new video, and I try to put out one every workday. This is a winnable fight when you really get down to it. For basically 28 bucks, 38 bucks, you can get your A1C level checked. And if it's above 5.4, you got a problem. You've got excess blood glucose. And it's, but look on the plus side. It can be reversed. Just because you have an A1C over 5.5 does not mean that you're going to die tomorrow. My A1C, when I first started this program, was about 6. I was a type 2 diabetic, just nobody had ever told me yet at that point. But, and when that happened, it clogged up the back of, the veins in the back of my eyes, and I was going blind. But that's all gone. It's all reversed. Thankfully, because I found low carb. So you can do it. If your insulin level, your fasting insulin level, if it's between 2 and 5, you're doing fantastic. You have not fried your pancreas, and your insulin level is staying very low, which is what you want, which means you're going to be losing weight, you're going to be losing fat, your body's going to be in a great metabolic health. If it's above that, don't freak out. Get it tested in a few more months. After you've been doing low carb, odds are it'll be down to a reasonable level. It's really kind of cool. I mean, that's the nice thing about chronic conditions. They're not going to kill you overnight, but thankfully you can get over them pretty darn quickly too. So that's what we're hoping to do. Hit the like and subscribe, and I will talk to you soon. This is Kirk, the Bariatric Carnivore.